Hello and welcome to our YouTube channel today. It's a treat for all of us. On High Demand, we would like to talk to Dr. Aditya Shah, who has finished his medical residency and doing a clinical fellowship in a prestigious institution in Midwest. And to preparation for this talk, he has run a he has run a poll on Twitter, which is leading a change in there. And I'm sharing that screen with you as well with IDDoc Adi. He has run this survey for us, for our learners, that what people think, and more than 600 people have taken this survey. That should tell you that what is more important as you prepare for your USMLE journey or as you prepare for US medical residency. Dr. Shah is, as I mentioned, is a medical resident, finished his residency, and he's a clinical fellow. Not only is an excellent clinician and a researcher, but he's leading a change. So if you are on Twitter, please do follow. And he tweet for antibiotic stewardship as steward meme, hashtag steward meme as well. So do follow, and you'll be surprised at how much learning you'll do. Without any further ado, Dr. Shah, I would like to bring it to you. So first of all, thank you so much for being here. Our students have asked to record somebody who has done all these things. So please do share what tips you
Sure.
have for USMLE aspirants who are yet to take the exam or who have taken their exams and will be applying for the US residency or fellowships.
Sure. Thank you, Dr. Kashyap, for having me on your channel. Before I start off, let me tell you that I am an international medical graduate. I've faced the same challenges that your listeners and viewers are facing. If I can do this, anybody can do this, is how I would like to start off with. So, my USMLE journey, the tips that I would break down would be into five main blocks. Number one is USMLE scores. Number two is US clinical experience. Number three is letters of recommendation. Number four is research. And number five is having a US clinician who can be your advocate. When it comes to USMLE studying, for me, what worked was USMLE first aid book along with USMLE World Question Bank. How I used to study is the questions that I got wrong in the question bank, I would annotate those learning points next to that relevant topic on the first aid book. Like, for example, if you got a question of alcoholic liver disease or cirrhosis wrong on UWorld, the teaching point should be noted down next to the topic in first aid. So when you read the first aid the second time, you can match that topic with the question that you got wrong. This is a strategy that has worked for me to get decent or good enough scores to be competitive when applying for residency. Second point is US clinical experience. Having been coming from other countries, it's only logical that US program directors and recruiting committees will want somebody who has had experience in the US clinical system. So for that, I would recommend you reach out to physicians in various hospitals in the country via email in topics of your field of interest so that you can work with them, see how the US clinical and education system works, show up on time, be honest, work hard, just be eager so that doing this US clinical experience ties into my third point, which is getting good letters of recommendation. If you do good clinical training in the US, you will get good letters of recommendation, which help a lot because you do need 3 US letters of recommendation when you're applying for residency. These letters of recommendation, the more harder you work or the more you impress the clinician, more personal the letters of recommendation are, which help a lot in a recruiting committee to tease out as to what kind of applicant there is. After you get 1, 2, and 3 done, or if you're lacking on any of these 3 main points, then I would recommend at least considering applying for either clinical research or bench research for a few months. Reach out to mentors or reach out to physicians who are doing research in topic that might interest you via email. So once you start communicating with them, how I tell people is that if you send 100 emails, 15 people will reply, out of which 10 will say that they don't have a spot. Out of the remaining 5, 2 or 3 will say they can't do your visa. Out of the remaining 2, 1 will say that we don't need anybody right now, but if we do need, we will call you. And maybe 1 out of 100 will eventually call you in for an interview, whether that be online or in person, so that you can then get some kind of a volunteer research job to build on your CV. These are points: one, which is scores; two, US clinical experience; three, letters of recommendation; and four, clinical or bench research. If you do one or two or three or all four of these, you will likely network and reach out to somebody who will then be willing to advocate for you, which is my fifth point: to have a US clinician or a physician who will advocate for you, who will pick up a phone and call a program where you're applying for residency, that, hey, I know this guy or gal, and I trust them, and they would be valuable to give an interview for, is how I think you should approach this in a very logical manner. Step one, two, three, four, and five. To me, the more interviews you have, it's simple probability, the more chance that you have of matching. But remember that at the end of the day, whether you get 25 interviews, 15 interviews, 10, 5, 2, or one interview, you only need one good interview to match. So if I were to break everything down into 3 or 4 minutes, this is the 5 tips that I would recommend as to what has worked for me and what I would advise uh, other such IMGs like myself to try and ace this system.
Well, thank you so much. This is very informative. We
Mhm.
will hope to continue our interview and record more
Sure,
videos with you on those items. So at this
absolutely.
point, please do subscribe our channel, follow Dr. Adi Shah on Twitter, ID Doc Adi, and then follow his Stuart meme for antibiotic stewardship as well. He is a force to reckon with, especially in social media. You have no idea how famous he is, and we are lucky to have him. So we thank you so much, Dr. Shah.
Thank you, Dr. Kashyap.